The Federal Medical Center Jalingo was established in the year 2001. It is meant to fill in the gaps in the provision of specialized healthcare, where major specialized healthcare providers such as teaching hospitals are absent. These centers are supposed to mirror the standards of the teaching hospitals. One year after taking over as the medical director at the Federal Medical Center Jalingo, Dr. Aisha Shehu is working tirelessly to restore, upgrade and sustain these standards.
Everything. Our first engagement really was to assess the hospital in total. And therefore we sat down and set up what we call assessment committees, which has mainly 4 prongs to look at. To look at the personnel in terms of number, in terms of quality, in terms of also efficiency. The second aspect we look at is the issue of the infrastructure. How does the structures in the hospital look like? How good are they? Which are the ones that needed urgent attention? And which are the ones that we can hold on and wait? The third is, as a hospital, we use equipment to work. So the third was an equipment committee, which looked at the various sectors, including furniture and equipment, to report back to us to know how urgent some of these things are required. Then finally, how does the system operate? We just pick some department and they look at the operational system.
I, being the acting deputy head of clinical services, I chaired the committee on assessment of infrastructure. And we were able to assess the infrastructure, and our findings were actually very surprising because the infrastructures were almost decaying. We have assessed the entire buildings, the wards, the vehicles, roads, water supply, power, waste disposal, including the hospital fence.
On top of these findings is the need to address staff welfare at the hospital.
For some time now, especially the senior management cadre of this department, they have been stagnated from promotion. Some for 13 years, some 14, by no fault of theirs. If you fulfill all criteria, And you know, as a civil servant, when you don't get what you desire, you feel such change. You feel disillusioned, you feel, you're not happy with the system. That will not make you to bring up your best. But with the advent of this government, like I said, they went around to look for what was on ground, how was it functioning, whether it was optimal or not, the way out. And with this information, they were able to make positive changes. For instance, for the first time in the history of this hospital, we now have a full-fledged director of hospital services, who hitherto has been stagnated for promotion for about 13 years. We have five other deputy directors who too had not been promoted for over 13, 14 years. And the list is endless. That somebody had a listening ear to listen to these people and meet their cries is enough reason for them to go extra much to put in the best forward.
Next comes the creation of a pleasant, worker-friendly environment. Furniture and office equipment are availed to the workers. Renovations are carried out in most departments of the hospital. From the medical director's office, to the specialist clinics. The female medical ward. And also the female surgical ward. This was how the public health block used to look, and today it has been transformed to this. It is a similar metamorphosis of the old laboratory block. To take these changes beyond the glossy look, cases of out of stock in the case of drug availability has now been reduced to a minimal.
I'm the head of the department and also the competition of the drug development scheme. It's a scheme that ensures ready availability of affordable drugs within the hospital. And because the management took it as a priority to make drugs readily available, is one of the cardinal points. So they ensure that drugs are always made readily available. Within, you see, in the system, nothing can be 100% complete, because you have to talk about resources. As much as they could, they have supported the area wholeheartedly. So, out-of-stock syndrome has been reduced to the barest minimum. We are not there yet perfectly, but we are heading towards that by the grace of God. This is just 1 year.
In the case of enabling qualitative healthcare practice, various equipments have been purchased and deployed into service. An intensive care unit has now been successfully established.
A hospital without an intensive care unit, it is not really a complete hospital, because patients that require respiratory support in terms of mechanical ventilation, especially in this era of COVID-19, it is very important to have ICU in every tertiary hospital. So the development of this ICU has really improved the level of care of patients in this hospital. That is one thing I know. And then with the equipment-wise, I think we have all the necessary equipment in this hospital. We have like 3 or 4 mechanical ventilators. We have things that we need to work with and to make the patient care to be maximally obtained. So we have a number of anesthetic nurses. We have critical care nurses that are really working hard. And I think with this, the hospital is going to a level that a patient can be referred to this center for any critical support. I think she has recorded a remarkable achievement in terms of development of the infrastructures and the equipment-wise, especially in the theater, in the ICU. I can see we have ventilators in the theater, we have ventilators in the ICU, and the ICU is well kept in terms of staff and hygiene. So I think it is a really good development. I can see a lot of structures erecting, which even in the room, today I was in the room theater, it was really well equipped and well kept.
In a constant and unceasing pursuit of opportunities for the hospital, Dr. Aisha Shehu Adamu has sought for and has received various assistance from donor organizations, philanthropists, and healthcare partners. A major helping hand in her endeavor is that of the wife of the President of the Federal Republic of Nigeria, Haja Aisha Buhari, through her Future Assured project, in collaboration with Chief Emeka Ofo Foundation. Graciously received by the Federal Medical Center Jalingo are ventilators, monitors, surgical instrument, consumables, along with neonatal, orthopedic, and personal protection equipments. Through collaboration with the National Center for Disease Control, NCDC, an infectious diseases isolation center has now been completed. The Minister of State in the Federal Ministry of Health, Dr. Oloronimbe Adeleke Mamora, commissioned the project.
The glory of God and for the benefit of Nigerians, and particularly the people of Taraba State. And cause this safe and declare this place open.
On the same day, the Honorable Minister of State again commissioned a new molecular laboratory.
Distinguished ladies and gentlemen, we are here again to commission a project in the service of our people. The rights of Nigerians, and particularly the people of Taraba State, under President Muhammadu Buhari's initiative in the health sector. So, with the glory of God and the benefit of Nigerians, and particularly people of Taraba State, I cut this tape to declare this place commissioned.
Before, we were going to other states, Abuja, to run our COVID test. But as I speak with you now, we can do our COVID test in the new molecular lab.
The lab is the brainchild of the present MD. She has always been saying she will want to increase the scope of molecular testing because patients suffer, and also the hospital has delayed in acting on some challenges that will lead to the diagnosis, and the diagnosis not being here will have to send out. Endemic disease, Lassa fever, which has been killing our people, which has been making people suffer so much. So when we collect the sample, because of lack of facility, we will have to send. We send it to as far as Abuja, and sometimes it takes up to weeks before results get here. And you know, in a clinical situation, one's suspicion is in the mind of the doctor after assessment with the patient. The next thing is for him to confirm. And confirmation means laboratory diagnosis. So when you don't have the facility, you have to send it to places where facilities are available. So we need to send to Abuja. And because everybody in the country was also sending to Abuja, it takes time. Sometimes 2 weeks, and if you have a patient here, because of the danger of the patient waiting until you have accurate laboratory diagnosis before treatment is initiated, sometimes they get so bad that when the result comes, they are already dead, or in situations where even when intervention is given, the outcome is usually bad.
This is the molecular complex for Federal Medical Center Jalingo. Precisely, this side is our sample preparation area. As you can see, this is our safety cabinet, and it is the area where we prepare all our samples.
As a testimonial of the new positive projectile of the Federal Medical Center, here is the Honorable Minister of State.
It's a Chinese proverb that it is better to see something once than to hear it 10 times. So I have come and I have seen. Yes. So I can also tell you that what I have seen is good. Yes. And I am happy, and I commend the MD of this hospital and her team. I also commend the chairman of the board and the members of the board.
The Director General of the National Center for Diseases Control, Dr. Chikwe Ihekwezu, speaks.
I would like to thank the management and staff of FMC Jalingo, led by Dr. Aisha, Shehu, Adamu, who have all been very supportive through this process. Madam, your leadership and the support of your team through this outbreak has really been exemplary.
On the new direction of the Federal Medical Center Jalingo, members of the hospital management.
In the area of medical equipment, so many milestones have been achieved by this present management, headed by our able medical director, Dr. Aisha Adamu Shehu. From the isolation ward complex, we had achievement in so many areas in collaboration with the Nigeria Center for Disease Control. We have a kidney center well equipped in the complex, and we also have a direct radiology machine in the isolation complex. We have monitors, ventilators, and even direct radiology machine in the complex. All these are to help assist our COVID-19 patients. In the area of in the ICU, when we submitted our assessment committee, we noticed that there was no intensive care unit in the hospital. The management swung into action and put up an ICU with ICU beds, well-equipped modern ICU beds that are functional presently. Not just that, a digital mobile X-ray, it has been installed in the intensive care unit of the hospital with a portable ultrasound machine that functions 24 hours every day in a week.
Because there have been so many positive changes, developments, and satisfaction with respect to work. The way staff go about their duties, uncoerced, they do their work willingly. They look at it as part of the system, an inclusive kind of governance, so to say. Because at the advent of this administration, there was something they did. They went around every department, every unit, to understudy what was in existence. Like a system study. What was in existence? How was it functioning? Was it optimal? What can be done to improve on it? Every staff, not just limited to the heads of department, participated in it. They were part of it. Even going ahead to even suggest the way forward to improve the services. And when they start seeing those things being implemented, they felt happy that their opinions mattered.
Repositioning the staff for a better service is one of the main thrusts of the one-year-old administration. Transparency is pursued with vigor.
And Savicom actually has existed in this hospital long before now, even though not in the shape it is now. With the coming on board of the medical director, Dr. Aisha Shehu Adamu, one of the first things she did, knowing the importance and the place of Savicom in an institution like this, put up a new team, and we have already been inaugurated last year, and we have started work with all the materials and things we need to be effective have been provided for us. Savicom is actually an acronym, or rather a unit put together by the government of Nigeria to make sure that institutions deliver on the mandate for which they are created. So in this hospital, We are actually a unit directly under the office of the medical director. And what we actually do in Salicon is we are saddled with the responsibility of ensuring that there is smooth running of services, as well as customer and patients care, and then make sure that whatever challenges they have are sorted out immediately so that they can get the service for which they have come to demand from the hospital. Along the line, sometimes there are conflicts and issues that may arise in the process of getting these services, and we are also saddled with the responsibility of resolving these conflicts and making sure that the customer goes home feeling satisfied.
Professional ethics are also fostered at the Federal Medical Center, Jalingo of today.
We are so lucky in Federal Medical Center, Jalingo, that our current medical director, Dr. Aisha, Shehu, is the pioneer chairman of Anti-Corruption and Transparency Unit. Our request from the unit, from her insertion in office, has never been delayed. So far, my staff within the unit has been trained and retrained. We have already undergone various capacity building. We have gone for several workshops and training in Abuja and Kefi, in the ICPC Academy in Kefi, all those in an attempt to improve our working capacity. So for Anti-Corruption and Transparency Unit, I think we are doing very well with the current administration in Federal Medical Center, Jalingo.
In collaboration with the government of Taraba State, a building within the hospital is renovated and a second isolation center is born. Today, the Federal Medical Center Jalingo seems set to join global telemedicine with the completion of this new ICT hub. It is a collaboration between the Federal Medical Center Jalingo, Nigeria Communications Commission, and the Universal Service Fund. These specialists can reach out to experts across the world when in need of specialist advice, collaboration, and lending their own voice to the global medical common. The Federal Medical Center Jalingo Guest House has now been renovated so as to provide a befitting accommodation to visiting health specialists. A block of classroom from the old School of Nursing has now been given a total renovation and converted to the hospital's conference hall. With the construction of an extension of the medical director's office, a befitting boardroom has now been added, thus providing a pleasant and comfortable interface environment for governing board members, hospital management, and any visiting team of experts. A new neonatal center is now under construction. The new radiology complex is now in an advanced stage of construction. It is hoped that upon completion, it will provide a wider Eureka bandwidth to diagnostic investigations capacity of the hospital. The Federal Medical Center Jalingo, under the leadership of Dr. Aisha Shehu Adamu, is an organization on an ambitious drive towards catching up with the digital modern times. In an environment where many leaders remain analog, viewing new technologies with suspicion, what is Dr. Aisha's seeming romance with these new technologies?
No. In fact, I embrace technology. I've been doing all what I can to make sure I attract either funding or donations or any kind of help in technology. So far, so good. We have attracted support from USBF. They have been able to donate over 20 computers for us, which is accessories, a server, and also software for e-health. They've installed it, and currently we're about to start training so that it can be deployed. We thank them for that, and also we're engaging with NIDA hoping that they will also come to our support. We're also going to engage a lot of people. Ultimately, we want to start telemedicine so that people can, within the locality, can interact with anybody, any specialist around the world for assistance in e-health. We embrace technology, we like technology, and we'll do all what we can to attract any kind of technology that will make our work easy.
Many great things are still on the way for this hospital.
I've also tried to work on the manpower aspect, not because of getting more hands, but working on those we already have, to reorientate them on what we need to do, and also to give them that freedom to enjoy work at their workplace without any fear of intimidation and threat.
The speed, the passion, and the deliberate prioritization of addressing pressing needs raises the question of if Dr. Aisha has always nursed a dream for this hospital.
Yes, I joined FMC Jalingo in 2005 January from the University of Maiduguri. Immediately I came in, I noticed the gaps and challenges. However, knowing their different status, the fact that the University of Maiduguri is very advanced and FMC Jalingo was just starting there, I dreamt of a time when FMC Jalingo would also have the kind of facilities obtained elsewhere so that provision of healthcare can be optimized. I noticed gaps all over in structures, in equipment, in trainings of personnel skills, and so on and so forth. So, subsequent governments have always tried my best to make sure that I contribute the little I could to ensure that these gaps are bridged. So I've always nursed a dream of seeing FMC Jalingo as one of the best hospitals in the country.
What is the opinion of her colleagues on this 1 year?
During the last 1 year, we have actually recorded some unprecedented achievements and developments in FMC Jalingo. In the recent years past, we've really not seen this kind of improvements in the quality of our services and also the atmosphere of work. So we join her in celebrating. And I want to just mention a few. Within the last 1 year in FMC, the atmosphere of service has actually improved in that staff come to work feeling happy and they are happy doing what they do.
I am an Igbo man and we will say that a chick that will turn into a cock can easily be identified the very day it is hatched. So what we are seeing has really shown that our hospital indeed has gotten a leader that will see to the development of the hospital. I can assure you that the hospital, especially my own section, the lab, we are happier for it since the commencement of this administration.
Jalingo. For the first time in the history of Federal Medical Center Jalingo, we are having a medical director that has the mind that thought and deemed so fit that she wants to see her staff dressed in the correct ethical codes. Not only stopping at that, she also went further to make sure that these uniforms are provided for the staff free. This is a program that was launched about a month ago officially by the medical director, and we intend to take this program in phases.
For all intent, the Federal Medical Center Jalingo is taking efficacious dosage of positive mobility to meet the challenges of modern-day healthcare. To the Federal Ministry of Health, to donors, to the state government and philanthropists, it is all thanks. But like Oliver Twist, more is still needed.
So far, the federal government has been supportive. They've been domiciling a lot of projects within FMC. However, we still appeal for more. We still have a long way to go. We still have a lot of structures, a lot of equipment we need to buy. We want to appeal to them. The state government, we are resident in the state, and our service is to the people of the state. We're appealing for more support so that we can also put our acts together and make sure we provide the best kind of qualitative care to the people of Taraba State. To all non-governmental organizations, implementing partners, philanthropists, community leaders, and all, we are here. We are willing to work with you to make sure that the hospital achieves what it's meant to achieve and also to take care of the population. So I would like to appeal for more assistance. I appreciate the one already given. We will always be thankful, but we also want to ask for more. So thank you.
Today, the Federal Medical Center Jalingo has arrived at a threshold where its communities will be saved from the trouble of seeking referral to other federal medical centers. While at the same time, it is now tending towards the enviable position of a health institution where many will be referred to.